Hello everybody, Dr. Brian Dysfunction here. In this video I am going to be talking about non-pharmaceutical ways to reduce the symptoms of estrogen dominance. Enjoy. The most common symptoms of estrogen dominance in women include irregular menstrual periods, abnormal weight gain, mood swings, fibrocystic breast lumps, and breast tenderness. Here's a more comprehensive list of other symptoms that are involved in estrogen dominance in women. In men, the symptoms of estrogen dominance are gynecomastia, also known as man boobs, erectile dysfunction, and infertility. The symptoms of estrogen dominance are due to having too much estrogen in your body. This includes estrogen that your body makes and environmental exposures to chemicals that mimic estrogen known as xenoestrogens. Besides the sex organs such as the ovaries in women and the testes in men, other organs in the body produce estrogen. The liver will produce some, and another huge producer of estrogen is fat cells. So the more fat you have on your body, the more estrogen you're going to produce. Once your body produces the estrogen and it circulates in the bloodstream and does what it needs to do for your body, it eventually goes to the liver to be cleared out of your body. And so individuals who have problems with their liver could develop estrogen dominance simply because the liver is not able to clear it out of the body as fast as others. Another contributor to estrogen dominance is chronic constipation. Now, normally when your body produces estrogen, it goes through the liver, it gets detoxified, the chemical gets changed a little bit and goes into the digestive tract for you to be eliminated from your body. Now, if you're having chronic constipation, then the length of time that it takes to eliminate these things from your body increases, and that increases the probability of certain species of bacteria getting a hold of it and converting the metabolites of estrogen back into an active form, and your body will reabsorb it. And the last major cause of estrogen dominance, as mentioned earlier, is your exposure to environmental chemicals that mimic estrogen known as xenoestrogens. The treatment of estrogen dominance is based on the causes that I just mentioned. So decreasing your body fat, improving your liver function, finding the cause and treating your constipation, and eliminating your exposure the best you can, eliminating your exposure to xenoestrogens. The best way to lower your body fat is, in my opinion, to do intermittent fasting, and for that I recommend the 5-2 plan. I made another video about this, and I'll put a link down in the description below for that. The other way to lose fat, of course, you guessed it, is exercise, and I recommend doing weight-bearing exercise, that's weightlifting, every other day, and then the days in between those you either do walking or stretching routines. I put a link down in the description below for the home workout program that I personally do and I always recommend to my patients. To optimize your liver function, you want to eat as healthy a diet as possible and stay away from foods that could inhibit liver function, such as refined sugars and alcohol. Now, there's a specific food group that you can eat too that could improve your liver detoxification of estrogens, and that is the cruciferous vegetables. So vegetables like broccoli, cauliflower, kale, and cabbage are a good choice. In addition, you could get a supplement which contains the active constituent of those cruciferous vegetables, which is diindolylmethane, or DIM. There's also a key mineral that is needed for liver detoxification, and that is iron. This mineral is often deficient in women who are having heavy menstrual bleeding just because they're losing blood. Now, it's very important to have your labs tested before you take an iron supplement. I highly recommend you have your doctor test your labs and don't take iron unless you know that you are deficient, because having too much iron could be a problem. If you are not having at least one large bowel movement per day, then you are constipated. And as I mentioned earlier, if you are having a slow transit time, which is constipation, then there's a higher probability of unfavorable bacteria converting the metabolites of estrogen back into an active form in your body, reabsorbing it. So you want to determine the cause of your constipation. The best way to do that is to do either an elimination diet or to get tested for food sensitivities. I made another video on this one, and I'll put the link down below for that as well. Once you determine the cause of your constipation, then things will get moving faster, and there'll be less likelihood that the bacteria will get a hold and be able to convert those inactive estrogens back into active forms. Here's a list of the most common xenoestrogens. To limit your oral exposure, you'll want to make sure that you're not storing or heating your foods in plastic, especially if those foods are more oily. So if you're purchasing coconut oil or olive oil or any nut butters, you want to make sure that those are stored in glass containers as well, because as long as they're sitting on the shelf in the grocery store or in your cabinet, they're going to be leaching plastic back into the food, and you consume it, and those are xenoestrogens. Those are going to exert an estrogenic effect. So storing food, you want to go and try and get glass containers or Pyrex containers, and of course any pre-made things from the store that are oil-based, you want to make sure that those are coming from a glass container. Another exposure is things that you put on your skin, so soaps and shampoos and cosmetics. You want to make sure that these are having as few of the xenoestrogens in there as possible. So the list that I just put up, you might want to rewind back and pause it and take a look at the list and make sure that none of the products that you're putting on your skin have these xenoestrogens in them, because any substance that you put on your skin will be detectable in your bloodstream within about 4 minutes. So make sure that you're checking those out. Last but not least, you want to limit your exposure to pesticides. So if you don't do anything else, don't spray pesticides inside of your house. And as far as the food that you're eating, you want to always make sure, if possible, if it's available and affordable, that you are purchasing and eating foods that are organic, which means that they are not sprayed by pesticides. And that's it. By making these simple daily changes, you can reduce your symptoms of estrogen dominance. If you like this video, consider giving it a thumbs up. If you haven't already, please hit the subscribe button and click the bell so that you can stay notified of future videos. I thank you for watching, and we'll see you in the next one.